And this is our office document. I want to start here with this bar here at the top of the screen. Just kind of go through some of the icons here. You'll see here this first one, Office Visit. If you click here, you have the option to add a new document. This is in case, for some reason, the reason for visit that was entered at check-in doesn't meet the needs that you have for your visit. So we have some other document types that we can add here. We have our Medicare wellness visit, we have a nursing visit, other kinds of visits. So if for some reason you need to add a different document type, you just go to this add new document, add it, and then it should update the screens appropriately for the type of document that you've added. This next icon here is the preview icon. If you click on it, it'll show you your note so far. Now, we haven't really entered anything into this patient's record so far, so we don't really have a note to show, but this would show what your office visit note looks like as we go through it. It's kind of a toggle button, so you can toggle between preview and edit mode. So if you end up in this mode and don't know how to get out, you just click this edit button and it'll take you back to the ability to add to the record. Next here we have the collapse all button. So the carrots here will open up and you can get into quite a bit of scrolling to go through. So to get to the next section, kind of a shortcut is if you just hit this collapse all, it'll bring it back to home state, and then you can move on down through the sections that way. It's a nice little shortcut. Next up we have the wrench icon, and the wrench icon has a few different actions that it's associated with it. First, we can use that wrench to add a section. Now, Meditech 615 comes with some questionnaires already ready to go. So, for instance, your PHQ-9, your Framingham questionnaires are built into the system, and they're designed to complete them in the system, and the scores of those will eventually report into your protocol section. So to add one of those, we just click Add Section here, and we can search for the questionnaire that we want to add. So PHQ, we can search, and this is the type ahead. So we type it in, we wait for it to come up, and we can see that it's brought us the PHQ-9. Now it's asking us, do we want to add another one? So we can look here for Framingham. And we can add it. And then once we hit save, then you'll notice in our list of sections, we have now a questionnaire section that's been added with our PHQ-9 and our Framingham coronary heart disease 10-year risk score. So this is kind of that's kind of the main function of adding a section. You can also add different HPI sections, and I'll go through that a little bit more when we talk about HPI. Some more functions of the wrench button is you can also use it to either delete the document as you have it or undo changes in your document. And the last one on the list here, create new normals, will be one I think that you might use quite a bit. So when we get down to the other sections, I'll kind of go through create new normals, but basically it allows you to create normals by section for different visit types, so that it's kind of a shortcut. So rather than typing everything or clicking all the buttons, you can just bring in your normals and it will sort of help you. Okay, and the last icon here is the normals. So whenever you do decide that you want to add normals, that's how you do it. And again, once we have some normals built, I'll show you how to do that. Next, we'll kind of look at the individual elements of the document and go through some important information about each of those. First up is our intake section here. So if we click the caret, and in these bars here, you can either click the caret to expand, or you can click anywhere away from the words. Sometimes the words have a different function, so if you click on the words, it gets confused. So if you just either click the caret or just click anywhere out here, and again, you know that you can also touchscreen enabled. You'll notice the font is nice and big so that you have the ability to touch also. So we'll just open this. And we have here we have here vitals that have been taken. So in the previous visits, we had vitals that were taken February 10th and March 14th. We have, if we're going to add vitals, we just click here, and it pops up this window for us to input the information. One thing to note here is that you have to either touch or tab between, like, feet and inches. So I have to do 5 foot, either touch or tab, 2 inches, and then hit enter for it to record. It's the way that it's set up. It's so if you just hit enter, then it'll only take like 5. It'll skip and go down next to the height. It's just the way that they've designed it. So for some reason we're defaulting to kilograms here. So I put in, click here and put in 125 and see enter, and see I skipped ounces, which is probably not a big deal. But if I wanted to do 125 and so many ounces, I would hit tab and then do 2 and then enter. BMI is automatically calculated. Blood pressure works the same way. 120, tab, 80, enter. And then we can go through and input all the information. These buttons, you'll get used to seeing these buttons a lot. That's kind of the convention for Meditech for a lot of this information. So we can say how we took the pressure, the kind of cuff we used, the location, that kind of thing. And just kind of moves us through, and then we get back to respirations. You can input as many of these as you want to. If you want to skip some, maybe you didn't take you didn't take their O2, you can just skip that, and it should be fine. And then save. And then it's added another column in here for us for today's vital signs. If you wanted to see a graph of your vitals, you just click this little graph icon, and it'll graph over time your vital signs. And again, you can update the time frames and that kind of thing. Next up is our visit reason. Now, what's important about visit reason, this is the reason that was entered by the front office. So it drives a lot of stuff further on down in the chart. It helps drive your HPI. But if for some reason what they entered was incorrect, we all know patients can call in with one reason, and then it ends up being 2 or 3 different other reasons that aren't even related to the first one. You can always add here, just add the new reason. So let's say that it was not COPD that she needed to be seen for, but it was asthma. We can click the asthma now, and then we can just take away the COPD, and then it will adjust the screens appropriately. Common things that get included are notes about the interpreter, who they were accompanied by, your ability to add or change allergies here through the allergy pop-up. So we could just go here and add, say they were allergic to penicillin. And you can talk through the type, so what their reaction was. And then you also have the ability to do medication reconciliation from here. Now, this patient doesn't have medications listed, so there's nothing here to reconcile at this point. You have your little meditor box here for the nurse's note, and this is because, again, your clinical support people will be entering most of that information in the intake section. An important thing that we really haven't talked about so far yet is this patient status. This is how we can sort of categorize our patient through their visit. We can see where they're at. So at this point, the patient is in arrived status. Really, we've just taken their vitals, so we can move them to intake, and that's how we're going to get our timestamps for reporting moving forward. So it's important that we make sure and kind of keep that moving. All right, that's kind of it for intake. And again, we're going to hit this collapse button here to take us back to home state and get ready to look at the next section. Next up, we have our patient, family, and social history here. We have medical history, surgical history, family history, and social history. Now, medical history and surgical history are actually one list. So if we open up this overlay here, you'll see that we have history of tonsillectomy as our surgical history, and then we have our COPD here as our medical history all on one list. If we add a new problem, let's say we were going to add asthma. Again, it's free text, or it's not free text, it's type ahead. So if we do the type ahead and we wait, the list will come up here. If you do have this, see the lowercase asthma says free text. If we choose that one, then it will not have some of the checking and connections later on in the system. So it's best that we wait and pick the one that's actually connected to a code here. So we click here, asthma, and it adds it. It says it's a medical problem and it's acute. We can change this. So let's say that we want to change from medical to surgical, not appropriate for asthma, but you do have the ability to change it from medical to a surgical or social history category, depending on how you'd like that. We've done quite a bit of work to make sure those come in appropriately and make sense, but in case they don't, you can make those changes there. Status here, we have the ability to change it from acute to chronic, and then also active to past. So maybe it was resolved, but you want to still track it on your active list. You could make it resolved active, and then once you didn't want it to show up on your active list anymore, you can move it here to past. We'll leave it here at acute. For add to problems, this will add it to the problem list for you to manage today. And then add to my is if you were maybe a specialist who only managed certain problems on the patient's list, you could add to my, and then there's the ability to filter out up here and just look at my problems. So if there were any that were just yours, you could filter out and look at my. They're still on the list for everyone to see, but you have identified those as your problems. Go ahead and click Save. And you'll see that it's added asthma here, acute asthma, on my medical history list. Surgical history works exactly the same way. Family history here, we have the ability to add either by problem or family member. So we have already mother listed, but we want to add maybe father. We would just say father. We can add other information about father if we want to. At problem noted here, do we want to add a problem related to dad? So we could say yes, and then maybe add, and let's say that dad had, CHF. We could then add that. If there was a problem listed that dad also had, we could just click and add that. The little arrow here next is ability to put in some more information. So you have more questions. So let's say dad was 58, and maybe a comment we could add, and then click Save. And then it'll give father's family history of CHF. Last section in the PFSH is the social history. Again, we can launch an overlay. It has a lot of social history questions about their living arrangements, their birth arrangements, education level, etc. Just click the buttons. Again, they have the buttons like you have. We'll see those pretty much throughout the chart. Once we've made some changes to the social history, you'll see we get the exit and save. We did not have those before. Exercise, tobacco, etc. So you have the ability to put in all this information. Now remember that we do need to capture some of the, particularly tobacco, for some of our quality indicators. We need to make sure and collect that, and that's where we would do that here. And this is also the section that will ultimately drive, at least for now, drive the protocols. That's it for PFSH. Next we'll talk about HPI. Next up we have our HPI section here. Now, because our reason for a visit was asthma, the system has added already this asthma 12 plus initial visit. So it's the first time we're seeing them. So we're going to get this HPI. Again, if that reason for a visit was incorrect, or if you need to add additional HPI, you can always go here to add HPI and add the HPI specific to either the problems that you have associated with this visit or a completely different problem. So you could just search for the problem and add here. Now this works similarly to whenever we had, remember up here I said that you had the add section and you could add, so if we wanted to add, let's say, well, let's see, CHF, let's try that. CHF HPI. So we could also add a section up there with the wrench. So either way, either add HPI or through the wrench add a section. Now the way this works is, first, for most HPI you should have a details section where you could click here and either drop in canned text or dictate or type whatever method you prefer, the history of present illness, or you can go through and individually select the buttons. Now this is also where we can talk a little bit about creating normals. So if we wanted to create a normal for this asthma visit, we could say no, click a few boxes here to say these are our normals, what we would expect to be our normals, and then go up here to settings and then create new normals, and you'll notice that it's pulled in for this visit what I have selected in those boxes, and you can do that for the whole entire record. So again, once we go through review of systems and exams, once I click all the boxes, I can go up there and click create new normals, name the normal, and every time I hit the normals box, it'll ask me, do I want to drop this one in, and I can let it know, and you can create as many of those as you like. So it's kind of a nice new feature that's been a recent update. I'm going to just exit. I'm not going to save anything. Once I've selected all the boxes that I'm interested in, I can close the section. Two buttons up here I want to point out is the save. We can always save, so if you want to save where you are, you can just click the save button and it'll update the record for you, so that if you do lose connection or get kicked out, it should bring you back and you should be able to have what you've gotten saved. Again, we have additional comment box here at the bottom of HPI. That's just for anything additional. And that's pretty much it for the HPI section. Next up is our questionnaire. And you'll remember that we added these two questionnaires earlier with the wrench icon. This particular section does not automatically flow in as part of a document at this point, but as soon as you add one of those questionnaires, it will populate the questionnaire accordion here. Again, we have the ability to create normals for questionnaires. We have here the PHQ-9 that we loaded in, and the way that it works, you can go in and answer the questions. Once you've completed all the elements, the system should create the score. Now we do know at this point that we have a bug in the system where the score is not working correctly, but once they get that fixed here in the next couple of weeks, but then certainly before we go live, you should have, when you put in the information for the PHQ-9, it'll automatically score that. And again, that score should then move into your protocol. So when you review your protocol the next time, you should have the PHQ-9 populated in your protocol. Same thing with the Framingham. And any other questionnaire that you add, you should be able to add the information and it will calculate the score and populate it where it's appropriate, and also include that in your Office document. That's kind of it for the questionnaires, just a quick overview there. Okay, next up we have Office procedures. If we open the Office procedure accordion here, you'll see that I have a peak flow and a pneumovax that are listed here. Now I went ahead and entered those orders earlier, and if you look here under outstanding orders under this patient, I have both a point of care A1C and then this peak flow and Pneumovax that are ordered. Now, all office-based labs, all office-based immunizations, and all office-based procedures should be documented within this office procedures section. So if you click here on the overlay underneath the peak flow, I can go in and I can put the details of my procedure in here and click Save. And then you'll notice that that documentation for peak flow changed from no documentation entered to completed. I can do the same thing here for my Pneumovax. So it drops in some of the information. I can say where I gave it. And then I'm required to do my VIS given date, so I gave it today. And I have a red asterisk here by the publication, so I'm just going to put 1/1/2014. And then save. And again, this has gone from no documentation to completed. Now I still have that A1C to do. Labs are a little different. If we click the overlay here for office procedures, and I go change this up here from procedures to results here in the middle, you'll see I have this POC A1C listed, so it's waiting for me to document it. Under specimen, it says office to collect, which is what it'll default to when it's ordered. And once we've drawn that or we've taken that sample, we want to change that to has been collected and either sign or save up here, depending on what option you get. And now I can put in my A1C result and hit save. And so I've documented all of my office procedures, and I can save now. That's pretty much how office procedures work. Now, one more thing is, if you didn't order the office procedure ahead of time, say you examined the patient, determined they needed maybe an ear irrigation, you can also just go up here to office procedures and hit add procedure and either type the search or scroll to find what you need. Click it, and then it should have populated it here down on my list. So I can again put in my information and hit save. That's pretty much it for office procedures. Next up, we'll talk about PQRS reporting. The next section here is our PQRS reporting section. We open the accordion here. You'll see that the way Meditech has arranged this is to, by each CMS indicator, given additional information that you can record. Now we are working on a project, and Meditech I think is working also on a project to help incorporate some of these elements into a more natural flow of your documentation. So for instance, in intake, whenever you see BMI, you maybe have the opportunity to document that you've done some kind of follow-up within the intake section, or maybe somewhere closer that makes a little more sense than having this separate section. But for now, they've included all the elements, and every possible element has been included, even some that we don't really at this point use within our system, for instance, which is knee replacement. But this is where you would go in, so you review the BMI, you see that it's out of range. You can document here that you have assessed it. Again, you have the arrow where you can drop down and add more information and determine your next plan of action for that. And we can go on down through that and work on assessing and completing the documentation that's appropriate for our patient. Next up, we'll talk about the assessment and plan. Last two sections we're going to talk about here in the office visit document template is the departure and coding sections. We'll click here under departure first, and we'll see that we're going to provide a visit summary, Here under education, we can add any education forms that you'd like to add. All of the CRAMES education materials are preloaded into the system. So if we wanted to provide maybe heart failure instructions to this patient, we could click here under heart failure and add that. You can add as many as you'd like, and they'll print off with the visit summary for the patient after the visit. Now, if for some reason there's one added here, and there are some diagnoses where we have pre-added education forms, if you'd like to not have those included, all you have to do is simply hit the red X and that'll take that away. Down here under forms, we also have the ability to generate letters. Now these letters at this point don't have the ability to modify them on the fly, so you can't add dates or update information within the system. That is a request that we've made and we suspect to have soon after Go Live, but for Go Live we just have letters that will print out that are generic letters where we'll have to write in the dates, so you'll be able to say they can go back to school and then write in the date that they can go back to school, etc. We have the ability also then to pick, you can pick when they need to follow up, so if they need to follow up in 2 weeks, we can click here and then that will give the instructions to set the appointment for a follow-up in 2 weeks. And that's pretty much the departure section. For coding, we can go to the coding section and you have both new and established patient level of care codes. Your diagnoses are here with qualifiers. You can put additional information about time spent. So you can click what you want to code the visit as and hit the save button. And that's pretty much it for the document section.